what I'll ask you to do is if that you don't want to be included, your image included or your voice included, just mute your microphone or stop your video and just listen in. And if you want to communicate with us, you can always use the chat tool that's available as a form of communication. So, but if you're happy to be included into the webinar, put your camera on, put your microphone on. We'd love to have you participate. Tonight is our inaugural research seminar. We are an organisation, the Australian New Zealand Medical Radiations Research Network, and we've put this webinar series together as an opportunity to have imaging and radiation therapy professionals to get together, regardless of whether you're a novice researcher or whether you're a seasoned researcher, a well-experienced researcher, to come together and share ideas, find research resources and offer your expertise or benefit from other people's expertise, and provide an opportunity for people to collaborate. So the ultimate desire of the Australian New Zealand Medical Radiations Research Network is to increase high-quality medical radiations, MRI and sonography research to add to scientific literature to improve diagnosis and treatment outcomes for our patients. So the aims of this particular series is to provide a chance to meet and network with others who work within our field. So a little bit about tonight. I'll just tell you a little bit about the meeting. Tonight, myself, Peter Kench from the University of Sydney. I am a senior lecturer there and involved in teaching nuclear medicine and medical radiations, but I also supervise honours and higher degree research students. Also, we have Michal as our co-host. Michal, can you introduce yourself?
Okay, yeah, I'm Michal Schneider. I'm an associate professor at Monash Uni, Department of Medical Imaging and Radiation Sciences. And like Peter, my main job is to look after research students, and that actually encompasses all fields of radiation science, including ultrasound and nuclear medicine. So I'm the academic, and I hold their hand and help them through the process.
Fantastic. Thanks, Michal. So tonight's webinar will run for about 30 minutes. We really only have 40 minutes in total because this software actually turns itself off after 40 minutes. So we need to keep to our tight time budget. We are going to record this seminar and make it available to our members in the future. So hopefully we can post it on our website as an opportunity and review it or share with your peers if you wish in the future. The format of tonight's meeting is to have a Q&A. So I'm going to do my best, Tony Jones, and with Michal, we're going to run a Q&A session with some PhD students who are at various stages of expenditure. Some have finished, some are about to finish, and some are on their way, along their way in the journey. So these are PhD students from Monash University and Sydney University. And I think it's probably a good time just to I'll just ask each of the students to introduce themselves. It should only take a minute. And all I want you to do is tell us your name, what your background is, so what you did as an undergraduate or as initial postgraduate studies, and the title of your project that you're actually worked on or working on for your PhD. Cameron, do you mind if we start with you?
Sure. Okay, hi everyone. My name is Kamarul Abdullah, and I am a final year PhD candidate at the University of Sydney with a major concentration at computed tomography. I am an international student who is coming all the way from Malaysia and had involved in medical radiation science area since 2009. I was working as a radiographer for almost 3 years before I decided to join academic area. And since then, I had involved in teaching and different areas of research, although my research interest is still in computed tomography. My thesis that I'm currently working on is about optimizing CT protocols for cardiac imaging using 3D printing technology. And in this thesis, I had developed a phantom using the 3D printer and used it to optimize the current coronary CT angiography protocols at one hospital here at Sydney, and use it to optimize and the dose saving strategy that I am focusing on is the iterative reconstruction algorithms. Yeah, that's it.
Fantastic. Thanks so much, Kamarul. Thanks for getting things started. Richard, are you with us tonight?
Yes, I am here. So I'm Richard Oates. I'm
Thanks,
radiation therapist working at Peter MacCallum Cancer Centre, where I've worked for, 11 years, having taken a year off to work in Wollongong for 1 year. So my PhD, which I've recently completed, was looking at prostate radiotherapy margins. So looking at how we could reduce the margin for prostate radiotherapy. So we looked at a couple of different approaches. So one of the approaches was using a diet intervention to reduce the amount of motion of the prostate. And the other approach we looked at was looking at adaptive margins. So could we predict when the prostate was less likely to move? And then can we apply a smaller margin to the treatment on the days when the prostate is less likely to move? And so, submitted my thesis earlier this year, and that's all wrapped up now. So I'm in the world of postdoc.
Thanks, Richard. Thanks for the introduction. Could I introduce Asmia?
Asima.
Oh, my apologies.
That's okay. That's okay. My name's Asima, and Michal's my supervisor. So I'm in my fourth year PhD. Mine is on neonatal cranial ultrasound, and we are looking at assessing its safety, the knowledge base, and about its practice Australia-wide.
Okay, so this is a Q&A, so I really do encourage participation of all those involved in tonight's webinar. So as I mentioned, a good way to do that is to use the chat box, but I'll also ask for audio questions as well as we move along. What we've done is we've prepared some questions just to get things rolling. And what I might do is open up to the panel, and might start with you, Kamarul, just to ask you the question, what got you interested in doing research? What was the catalyst or the thing that motivated you most to start a career in research or training in research?
Actually, there are many reasons that makes me love the research. One of the most, significant reason why I love research is because I believe that research can make a difference. There's nothing good than knowing that you are contributing to the discovery or development of something different in life or change in the world. So I think every contribution matters. That's why I think the reason of why I love research.
Thanks, Kamarul. Richard, do you have anything to add?
Look, I have a science undergrad, so I'm naturally interested in the scientific method, and I always think there's unlimited questions out there and they're all looking for an answer. What got me into radiotherapy research was each day as a practicing radiation therapist, seeing problems or a question in the workplace and thinking, how can we answer that? How can we come up with a solution to that problem? And so that's what sort of drove me to participate in research and hope to find answers of ways to improve the treatment process for patients and hopefully improve patients' treatment outcomes.
Fantastic. So you can see that the possibility of an improved outcome for a patient is a huge motivator for people who work in healthcare to get involved.
Can I ask Richard, do you see any of your work actually has tangible benefits, like has translated straight into your patient care?
So for me, we're at the stage where we probably need one more study for each of the methods that I've approached to actually implement them into clinical practice. However, it's an area where you can see the benefits that can be translated there. It's just a matter of sort of finalising those processes, demonstrating the efficacy, so that we can apply it to the patients and really get those outcomes that we're looking for. And someone's asked why prostate RT. It all sort of started off. I was working on a treatment machine where we'd see the patients come in for treatment every day, and frequently the patients would show up for treatment with, a full rectum, a rectum full of bowel gas, and I'd read lots of literature that indicated that causes the prostate to move around. And so the question was, how can we reduce this motion with the intention of reducing the margin that we require to treat the patients?
Thanks,
it's
Richard.
a nice sort of practical project. And I think it's a great example of a project that is translatable. That's why I raised it, because a lot of professionals who start their research start with a clinical question and start off that way and sort of get caught up in asking questions and wanting to find answers.
Sorry? How did you choose your supervisor? And I'm saying that knowing that your supervisor is also involved in this webinar.
Should I turn off my...
Yeah, maybe you should. We'll call you back in a moment.
This was for me, aimed at me?
Yes, it is.
I think I think Michal I got a lot of encouragement from Michal, because one of the international or national conferences we went to, Michal was giving a talk on doing more research in our field of study. And I think at that time I was doing my postgrad deep in ultrasound. And from that I got encouraged to just do an extra year and do a master's. And I thought, another year's not going to hurt. And when I did my master's, Michal strongly encouraged me to try and publish it. And so it kind of just, it took a year or so, and then it got published, and I kind of just naturally then enrolled into a PhD. So I never really thought about, okay, I have to do this, then go and enroll. I sort of just fell into it, but with a bit of encouragement from Michal. And I think also because my master's was a very practical topic, and I saw a process change as a result of my study. And I saw a lot of the radiologists at work quote me and, change their practice because, your study did this. And that was a huge encouragement. And that was the reason why I then perhaps went on to doing further studies.
Has any of you heard your peers or other people talk about how they choose their supervisors, what sort of attributes they're looking for in their supervisors, or what makes a good supervisor? Because it's my understanding it's always a very important decision to match yourself with a supervisor that is going to help you through that journey, because it can be quite a long journey too.
From my experience, I think a supervisor who's not afraid to publish results that may conflict with their own beliefs. I think that's one of the biggest conflicts that I had was some of the not a direct supervisor or people who were involved in the research they had a conflict with me perhaps publishing anything that kind of didn't portray a respectful or a good image of current practice. And I think that's what I found a bit challenging, to try and convince that person that it's okay to publish something about our own field that says that, we can do this better, or that, we're not doing it perfectly right. And I think a supervisor who's sort of on board with that sort of mentality helps a lot.
Yeah, someone who's open and willing to be critical about all practice based on
right.
evidence.
Yes, that's right.
Okay, great.
Let's face it, any most novel ideas are, you start off with criticism from your peers often. Why are you doing this? You already know the answers. And then you say, but we don't know all the answers. And somebody has got to do the research. So, so you have to be ready to cop some criticism from other people. But that's the only way to move the profession ahead. It needs people who are strong and who can lead.
Now, Carol, I saw your hand was up. Do you have a question?
Yes, I was just going to kind of contribute in terms of supervisor selection, and I found having different supervisors who had different kind of expertise that they could contribute to the supervision was really helpful. So having a supervisor that was experienced in the professional side of things, having a supervisor really experienced with writing a thesis and academic writing, and having somebody that was, again, with expertise in a different area, having 3 different people contributing to my learning really, really valuable. I think on the other hand, sometimes that could get a little bit confusing because everybody has their own opinions on things, but I think ultimately for me that enhanced my experience because of the diversity, and it added richness to my experience.
Thanks, Caroline. I know in Cameral's case, he was studying full-time, and that doesn't make it any easier because it's, you have a tight time frame to work to. But I just want to ask Richard and Asmir, maybe Richard this time, how did you manage part-time work and part-time study? Was that a difficult balance? And a private?
I think it was full-time work, wasn't it?
Was it full-time?
Well, quite close to full-time work. I was lucky that I was able to get some support from my workplace in some protected time to undertake my research. So you have to be mindful that it's probably going to take up some of your home time as well. So having a very supportive family is a very big aspect of undertaking a PhD. They might take a holiday where your holiday is to do work for a week, so expect something like that along the way as well. But if you can get protected time within your workplace, it's amazingly helpful, and it's really important to use that time efficiently to make the most of it.
And I think it's important to know that most universities offer flexible time, so you can take intermission and, if you feel like you need time with your family. I mean, quite a few of my students have had babies or had to move or something like that. So a major life event, and you can put your PhD on hold and then come back to it if you have to.
I had a lot of support from work as well. So my boss was extremely, I got a lot of study leave, and I also had to hack into my long service leave, which I was glad I had. But one thing I found different about studying for a PhD as opposed to sort of studying other courses is that you kind of need...
I wouldn't mind just asking a question about participation in conferences. Now, conferences are often a great place for people to go and present their work, collaborate with other researchers, get ideas, talk to people on stands, maybe meet their mentor or meet someone they've been reading about in a particular article, that the research that they follow. Can you give me a little bit of a snapshot of your experience as a student going to a conference and what that was like to be involved in that community?
As a student sonographer, I was encouraged by my boss at work to do a student paper. So that was the first exposure I had at sort of presenting at a conference. And I think that sort of gave me a bit of confidence. And then Michal encouraged me a lot to present at the conferences. And it is a little bit daunting, and it doesn't matter how many times you practice, it's still very scary. But I think it's quite encouraging at the same time, because afterwards people come up to you and they ask you more questions about what you're studying and what your research is about, and that kind of sort of then gives you more encouragement and a bit more confidence that, okay, what I'm doing is interesting, and people are interested to know more about it. So I think as daunting as it is, I think it's good to get more publicity about your research out there.
Yeah, I agree with Seema. Yeah, that's presenting at conference is very important, especially for research students to get exposure with meeting with the expertise out there who know better than the research students. And it's also important for the research student to present the current work so that it can be improvised, getting some feedbacks from the experts during the conference. And I was lucky in Sydney University, we have like fun for the students to go for the conference.
Yeah, I think also along with what Asima and Kamarul said, it's a great opportunity to collaborate with people as well. So you have people who have similar ideas, and there is the potential that you can get on board with some of the work that they're doing, or they might look to collaborate with some of the work that you're doing. So it's just a fantastic opportunity.
And in Richard's case, he ended up collaborating with Townsville. And set up a whole new group there, which was a really good collaboration.
Okay, well, I'm mindful that we're down to, of the clock's ticking down, we've got 9 minutes remaining. So we probably still have a chance to have a bit of a chat before it closes down. But I would like to thank the students tonight, Kamarul, Richard and Asnia, for participating in tonight's event. It was really interesting to hear your perspective on those types of questions and to hear about your experiences. I wouldn't mind just opening it up to everyone who's participating tonight and just ask you some questions about our next seminar, and if you think this is a worthwhile format that we're using tonight, any ideas of how things can be improved, whether maybe we should be more than 30 minutes. We thought initially that 30 minutes would be a good time frame, but I could see tonight we could talk for another 20 minutes and that would be fine, and we'd still have lots to say. And maybe how often should we have these type of meetings? Are they a sort of thing that we should hold once a month, once every 2 months, twice a year? So feel free to turn your microphone on and have your say. You can go onto the chat and add something as well.
I think it's important to know that people can access most of our participants via the website. Our contact details are there, so you can continue to talk to people if you feel like it, and you have any questions. Someone's already posted their email, obviously wanting to engage. And I think this is a great starting point for everyone to collaborate, to talk to each other. And in the end, what we're trying to do is encourage people to take that step and, ask questions if they have any hesitations, because I think once you are in this research framework, it kind of takes over your whole professional life, and you say to yourself, what did I do before? So we want people to engage and ask questions and meet up and talk to each other.
I think Megan made the comment that we probably need more time than 30 minutes.
Does anyone have any particular topics they think would be useful to raise in another?
I think it would be a great idea to actually have a topic of discussion before we have the webinars, so that someone can prepare for that.
So a bit like the MedRad Journal Club, they put some articles up or put some background reading up beforehand. Is that what you're thinking, Ernest?
Yes.
Yeah.
Maybe like a week before the webinar.
We're thinking of also running like master classes in how to evaluate papers, research papers.
Okay.
and do things like that. But we are, gathering information from people on what they want us to do and organize in the future.
Oh, I think that's a great idea.
I think Kelly makes the comments that you can go to the website. It's pretty easy just to find the website by searching ANZMRRN, and it should crop up in your browser. And there's the ability there for you to become a member. It's free, and you'll be part of the email blasts and told about meetings that are coming up and opportunities to get involved in training and seminars like this. So I can encourage you all to do that. Yes, thanks.
Sorry, Peter, it's Kelly. Just to jump in, just to remind everyone that check that your profile's up to date. So you can check your own profile, but you can also obviously find other people. But if it's not up to date, then send it to us, because it will bounce back from the mail printout or send out that goes. So let us know if you have something. And I think there's also obviously Facebook and those sorts of things that Megan updates regularly. So if you subscribe to all of those, you'll make sure that you get all of our announcements.
Fantastic.
Yeah, and contact us if you have any suggestions, ideas, or feedback for us about the webinars. It's something we want to run regularly and improve on all the time.
So I had a couple of suggestions about the timing, maybe once a month or once every second month, because months around very quickly. So we can look at
There's a question on the chat line, who to contact with ideas for future webinars. Peter, who should we make it out to?
You could just send it to me, because I'm looking after the webinar series at the moment. I'll share it with our working group. Hopefully my email came out on the blast, but otherwise my name is Peter Kench, and you simply just go peter.kench@sydney.edu.au, and that email will get to you.
Or any of us, Kelly, Caroline, myself, Debbie, Megan, anyone, and we will pass it on and discuss it.
Yes, that's great.
I think it's also possible to probably send to the email address for the website. There's a generic email address there, isn't there?
Wonderful.
That's great if people interact and we get lots of ideas and, start something happening every 2 months or so and grow the group who participate.
Yeah.
That would be fantastic.
Yeah.
So look, we're down to our last 2 minutes, so we may say our farewells. And so thank you everyone for coming along and participating. I'm really quite pleased that we have 20 people participating tonight. That's a great start for this series. The intention was to record it, and so we'll have to make that available to your website. Make sure you tell all your friends and your peers if you had a good experience, and encourage them to participate in the next meeting that we're having. Okay, so I'm going to finish
and
off.
our students, I think our students are available online as well. So if you have questions to them about the experience, contact them. I'm sure they'll be happy.
Or if you have any feedback about the webinar, you can also send it to that generic ANZMRRN membership type feedback emails as well. So
or any questions about supervision or practical questions about undertaking research, any of us can help.
Fantastic. Look, I'm going to end the meeting there before it ends itself. So thank you, and hopefully see you next time.
Thanks, Peter.
Thank you.
Thank you, Peter.
Bye.